So thank you all for joining the panel discussion. We have a lot of very interesting talks. I think I really learned a lot. And I would like to start this discussion, which is supposed to create something like a wrap-up of the event today, with raising again the question of decentralized versus centralized approaches to proximity tracing, which was actually in Europe a very heated discussion. So we had open letters being sent a couple of weeks ago, and there was a lot of debate, partially also a somewhat emotional debate. And I would just like to hear a couple of opinions on that. What are the pros or cons and of centralized, decentralized approaches? Did we take the right approach? How was this actually decided? Was it not maybe in the end that Google and Apple decided for one of the approaches and stuff like that? And I would like to open this by passing the word to Professor Lam in Singapore with the very simple question: how did this discussion appear in Singapore or in Asia in general? Was this a very European discussion, or was this something that you actually also followed?
Okay. I don't think we spent that much time debating whether it's centralized or decentralized. I think, of course, on one hand, when this contact tracing app was launched, initially people were skeptical, and the provider of the app did spend a lot of efforts explaining the privacy protection features of the app, as well as publicizing the technical details so that people can assess it. And also they make it voluntary rather than mandatory contact tracing. So, and I think the good thing is it started in the right approach. That means rather than forcing people to install and without telling people the privacy protection. So at least initially, in fact, I think the app was not that widely installed. It's just later on when the problem became more severe and people felt the need to have the app. So I think that's how the app started to pick up. And don't forget, the app was launched in March, but in April and May, we were also in a kind of a lockdown stage in Singapore. Basically, we are not allowed to go out for 2 months. And even though in most part of June, when we can go out, the kind of thing we can do is still very limited. So I think people saw the need of helping the authority to control the problem. So people became, so that's why a lot of these control measures became a lot more receptive. And I believe this is one of the reasons that as a result, there were a lot less discussions or debates about whether it's centralized or decentralized. So my personal view is it's more like you are paying a lot more energy in this problem rather than the original problem of the COVID-19 itself.
Okay, thank you very much. Art, wants to have a word on that?
I don't want to repeat the whole debate, which I still think is a useful debate. It has to do, of course, with the level of trust one has in society and comparing different kinds of abuse. But I think some very interesting research has been done in DP3T, and I can send the link to people if they want to show, in fact, that the difference in localized attacks is not as big as is claimed by the proponents of centralized systems. So I think the other concern of decentralized systems, that indeed you can do local attacks, but in fact, without all these tools, you can also do local attacks today. And if people want to follow us based on Bluetooth and Wi-Fi and with cameras, they can follow us anyway, independent of a pandemic. But I think one point I want to make, which I think is very clear, and maybe Singapore has less problems with this, if you're going to use these apps at an interoperable level, I don't see nation states exchanging with each other massive databases of infected people and their interactions with each other. So I think if you look at interoperability and you can't agree on one app, I think a decentralized solution, in addition to all the other privacy benefits, is I think the only one that's feasible, because it's such highly sensitive information where your citizens have been, and you allow for de-anonymization and cluster analysis on your own citizens. You're not going to give all this database to all your neighboring countries, even if they're friends. I think
okay,
that's
this part I agree. And even though we say we trust the authority a lot, and I don't think we are sharing this type of information with any other.
But that's okay in Singapore, given your geography. But in Belgium, if I drive 1 hour in each direction, I'm in a different country. And I think it's a very different reality than in Singapore, right?
Yeah, I guess, okay, during this period of time, our border is effectively closed. We can't go overseas. So that means the contact tracing problem has not gone cross-border yet. And at the research level, these are two different things, of course. At the research level, we were given $10 million Singapore dollars from the government to study this thing, this privacy preserving technique, so as to allow in future, if all the neighboring countries are doing smart cities. So in future, if you want to have this cross-border smart city applications, there is potentially a incentive or a need to share data, but yet they are well aware of the sensitivity. So that's why they're exploring cryptographic techniques to help solve the problem by using crypto-based privacy preserving techniques like secure multi-party computations, homomorphic encryptions, or even federated learning to solve the problem. But this problem, I think we're trying to be more forward-looking, because at this point we still cannot cross the border. So the contact tracing data is not going to be shared with anyone else. But when I mentioned that the government invests so much resource in our research center, is to anticipate the future potential need for cross-border smart city application, but not really for the purpose of the contact tracing. Yeah, but so in short, I agree with your point that these things should not be shared cross-border.
Yeah, we also had a question from the audience actually on decentralized versus centralized approaches, and there was a argument / question whether it might not actually be easier to secure a centralized server versus to secure a decentralized system against attacks, which is something to consider, because we all know that distributing computation and distributing systems makes it harder to secure things than if you have a centralized one. So I'm still I think it was Stefan Krenn who raised this from the audience, and yeah, Matthias, you.
Yeah, I think I would start. This discussion between centralized and decentralized has been going on for quite a while. So for Europe, at least, to follow up on Bart's discussion from before, I think it's pretty much settled regarding the interoperability. And a point I also wanted to add on that is that from what epidemiologists tell us, they can get all the necessary data from a decentralized system. Now the question is protecting the systems and any form of security or privacy leakage across these systems. Now, for protecting a centralized system, you will end up with one big juicy database that contains a lot of private information from a lot of people, which will become a very high profile target. Now, on the other hand, in a decentralized system, as proposed by DP3T, you end up with a lot of small devices. In the end, each individual user has a local copy of its data or of the tokens they observed. and all the computation that is being done in this model is done locally on each end user's device. Now, it is likely easier to attack the device of one single user and to get a limited amount of information compared to a highly protected central server. But the amount of information that a threat actor would gain from extracting a small set of tokens from one single device is very, very limited, right? And then scaling the attack so that the attacker would get useful information by attacking thousands, tens of thousands, or even millions of devices is very much infeasible. So we are looking at two different things, right? To get the same amount of information in a decentralized system, an attacker would have to attack large amounts of systems in parallel and in unison. And this would be highly intrusive and very easy to detect. Especially the heterogeneity and diversity of all the different systems. Like there are so many Android versions out there, this will just make it very difficult for an attacker to scale. So I think it's much harder to attack a decentralized system than a centralized system. But to be more concrete, we would have to specify attack models and what the goal is of the attacker, right?
Sure. I know. Does anyone else want to say something on this?
Yeah, me.
Yeah.
I think in decentralized approach, as far as I know, TP3T and the Google Apple framework, there are not a lot of data. So even when you compromise a smartphone, you have a very limited amount of data. So the question is, in the centralized approaches, you have much more data, in my opinion, from profiles where a person went and stuff like this. So as Matthias said, the threats, we would have to talk about the threats, but I think there are much more data you can gain from an attack on a centralized system because there are more data in the system.
I also would like to make a couple of comments. So for me, the question centralized or decentralized is a bit too generic concerning the complex functionality of the system we talk about. Like we have a couple of application level protocol exchanges in it. We have quite a number of stakeholders that may turn into attackers. And you can also engineer into a centralized system a couple of clever protecting mechanisms, because there is not a single centralized system we can compare a single decentralized system with. And I think we lack experience of designing such systems where we can build on a lot of well understood state of the art if it ties together so many different mechanisms. And also the functionality we want to have from the system. So at the moment we talk about warning apps, but linking it closer to what health authorities would would give a better system. And so kind of the discussion cannot end to a proper answer, in my opinion, as long as we don't nail down what kind of functionality we talk about. And is it just warning, or do we aim for something better anyway? And also, do we want to limit ourselves to today's hardware of smartphones? Or are we willing to invest in some better capable technology, like additional hardware components outside the smartphone? I think there is a lot of improvement given the high impact today's reality has on everyday's life. So probably there is a lot of willingness to spend for better solutions. Okay, so these were just a couple of remarks, and I don't want to occupy too much airtime.
Thank you. I don't know, does anyone have any thoughts on the role of Apple and Google in this centralized, decentralized, or in general technology debate? Because if I get things together correctly, then effectively Apple and Google, say, decide on the architectural level what is possible or not. Matthias?
Yeah, let's say there's a love and a hate relationship. So we've reached out fairly early to Apple and Google as part of DP3T, and we've been in close contact with all of them, working on all ends of like giving feedback on API, giving them feedback on how we think the interaction should look like, what options are about measurements of BLE beacons, of calibration. So we've been in very close contact. And on one hand, as we've also seen with many of the centralized apps, the ecosystem of Apple makes it extremely hard to implement something that is not part of the operating system that uses Bluetooth Low Energy to scan continuously. Right? So if you want an approach that allows you to exchange beacons without connections, then you will have to, then you require some form of operating system implementation. And this is what the Google Apple Exposure Notification API does, right? It enables such an API and implementation of the decentralized privacy-preserving proximity tracing approach as part of the operating system. Without this operating system support, you have to rely on connections, which is a whole other can of worms where it doesn't scale beyond 5 connections or maximum amount of people in a room when you're scanning, because you have to connect to every single device out there, which makes this really cumbersome and brittle as an implementation. And we've tried and tested these approaches and saw the many different issues with them. Now, what I don't like about the Google and Apple approach is the lack of openness. Right? So these are large companies. They've had teams working on the implementation of this, and not all of the source code is open out of their API, and it's embedded deep in their operating systems. And from an open source and implementation perspective, I would much more appreciate if all of their implementations were open source. In the last 2 days, we've actually seen both Apple and Google open sourcing chunks of their Google and Apple Exposure Notification API. So this is changing, which is a very, very good outcome. And I hope that this will continue like that. Thanks.
Yeah, thank you. I mean, just spontaneously, why are they opening up? Do you know the reason for that?
Well, part of it, maybe public pressure. The other part, they want to be like, they don't want to be responsible to some extent, and maybe they're doing the right thing. Right. In addition to that, so they are releasing they don't have anything. It's not a business secret for them. Android already is open source to a very large extent. Therefore, open sourcing this additional component is just one additional step towards this process.
I think one issue is that although they are open source, the main part of it now, we cannot really check if really this open source is implemented in the operating system. And I think this is really hard to check, requires a lot of reverse engineering. And as far as I know, there are no easy steps to do so at the moment.
This is an ongoing process, the open sourcing. I agree.
I think there has been also growing pressure, of course, of nation states as well. And given that more nation states are adopting this interface, of course, it would be much better if Europe could speak to them. I mean, we also already know from looking at the cases in court that if you want to move these big behemoths to do something, you have to go to European level. And then they may listen. I mean, they still may try to fight you in court, but at least that seems to be the only thing that has worked so far, is have enough economic pressure and have actually at EU level some pressure on this.
Yeah, that's certainly a point. I guess it's quite in the nature of company to be economically driven, and all other rationale is probably mostly secondary. This brings me to another point. I mean, we've heard quite an astonishing view from the different countries, and it became apparent that sort of every country rolls their own solution, has their own history to coming to application, has very different experiences with this. And say if you step back a couple of meters and look at it, that's actually in some sense very surprising from an IT point of view, because we all use the same navigation apps, we all use the same email systems, they are everywhere, the same protocols, but it seems like in this application area, the world is completely different. And I would like to investigate a little bit the rationale behind it. Matthias, yes, please.
That's not necessarily a technical limitation, but more a limitation of the health provider processes. Each country has different health authorities and different health authority processes, different laws, different legislative processes, and these applications, the exposure notification applications, tightly integrate into these low-level details of the legal system of each country with different requirements, and they have to interact with the different health authorities and the thresholds and metrics that these health authorities actually define. So if we want to have independence of the individual countries and enable them to make their own decision, they will require some form of individual apps. If it has to cost as much as the German app, that's an open question, but yeah, we'll see.
My view is to nowadays, whether it's mobile or internet or email is so pervasive in our life. I think we cannot avoid trusting some party in order to make our life more convenient. Whereas I would be more inclined to say that if I have no choice, it's still okay to trust one party for one aspect of my life. The worst case is there is one party that I'm entrusted with everything. One example is I can trust the bank with my money, but I trust another party like the hospital, the healthcare sector with my health records. But if these two put together, then I will have problem renewing my insurance, because one knows all the financial status, the other knows all about the health. So I think somehow, in future, some kind of framework to segregate different aspects of our life into different, if you like it, call it different container, so that they cannot, or enough firewall or segregation, so that they cannot aggregate the different aspects of data in order to create a super profile about myself. Then I think it's still okay. Otherwise, we are truly losing all the privacy completely. But as I said, if we want certain convenience in our life, like what again, the example, you trust the bank with the finance, you trust the healthcare authority with your health records, you trust the airline or the aviation systems with your travel or air travel. Actually, we are already trusting a lot to different types of service provider. But the worst is when eventually all these people somehow can aggregate all this data. That is the problem. I think that's why sometimes when this type of company merge, some regulator have to come in to say whether this merge will create other problems that we have not thought about before. So this is one aspect that we have to bear in mind as a balance. Security after all is again a balance between risk and convenience. So as a balance, we need where are the red line we have to pay attention to. When it crosses that line, is really serious. That's my view.
I think Google and Apple, of course, would like to be in charge of our healthcare, but they're not yet. I mean, they try for this business. For them, it's a very big business. And I just want to reinforce Matthias' point with a concrete example. Try to live in Belgium, work in Germany, and get to a dentist in the Netherlands, and then see which paperwork is being generated. And I think that will be such a mess today, even if we have all the EU, that I think it's actually amazing. We can actually get an interoperability scheme on paper in a month, and hopefully now it will only take 2 months to roll it out. So I think in that sense, we're doing much better than for a dentist visit.
Yeah, I would also like to evolve with Göran Kirchner from the RKI perspective. I'm wondering, so you're sort of, say, the operator behind that, and you bring in the actual rationale of the app, from tracing contracts, tracing infection chains and stuff like that. I'm wondering what is going on in international cooperation behind the scenes. So say from the IT and legal perspective, we see a very diverse, loosely cooperating Europe, but what's going on from an epidemiological perspective behind the scenes? Is there hope that things go better together in the future?
So if I understand you correct, I would say that I see that with these many apps, and I mean all these apps are making their source code and their rationales behind it open source. I think, and we are in exchange, for instance, with Switzerland and other parties. I would suspect that we somehow get closer to a common solution, especially when we try to exchange our data, and I think this is a good exercise, the whole development here. Mm-hmm. Because we profit from this openness, and that is my guess, that somehow the good ideas are exchanged, and sometimes we make compromises, but yeah, this would be my wish.
Okay, thank you. Yes, Philip, please.
Yeah, I have a comment and a question. So first, my question. So 3 weeks ago, I went to Italy and thought about installing the Immuni app, but then had the thought, what will actually happen if the app wants me? So how will authorities treat me there? Will I get back home? So in Germany, it's pretty clear. I will be tested, and which is something good for me. But what will happen outside of Germany? Can somebody answer this? So I didn't find anything on the web. I tried to Google a bit. So how do authorities treat if somebody who is just a tourist gets traced or even gets infected? Then my comment. So I think we now have these apps, and these apps are probably close to the best you can get with a smartphone. So I think they're all very good. So I think now it's very important to evaluate, does this help? How much does it help? And I think this is not quite easy. It's on the one hand not easy because we have this Google Apple interface, and this is proprietary. And even more, it's a decentralized approach. So at the end, the data that is of interest is how many infections did you prevent, and I fear that we will not get an answer. Yeah, maybe I can try answering this. So Switzerland today started releasing some updated numbers based on number of downloads, people that downloaded the app, number of active daily users that are refreshing the list of infected users to do the local calculations, and additional numbers on how many users chose to enter use the COVID codes. And what we are missing is the numbers of users that have been warned by the app, because the app simply displays a notification that says, hey, you may have been exposed. Now it is up to you to either call or do whatever you like, right? Because this is voluntary. The app does not try to betray the user, and this is on purpose and as designed. Now, what we are currently missing is, as part of these hotlines, part of a questionnaire that counts how many people actually called the hotline because of the app, and we are working on this. It takes time. We've mentioned, and Bart mentioned before, the different the processes of the health authorities. It's amazing that we get anything done in 2 months with classic processes, right? So many of these systems, they still use faxes to send data back and forth, and to update hotlines and provide information and so on is incredibly difficult on the back-end level. So we are happy that we can, or the Switzerland can provide information about active users, downloads, and number of used COVID codes at this point in time on a daily basis and going forward. So this is interesting. We are not there yet. We would like to see how many people have been warned and are calling the app, and how many people turned out to be potentially infectious after that. But the key number that we are missing at this point in time, but working on, is the number of people that are warned through the app. But this is due to many of these legacy processes that are incredibly hard to change. And this is not a technical problem. This is more an administrative problem, where you're working with different infrastructure that has been designed 40, 50 years ago, right? And you're trying to adjust these processes and bring them to the modern world.
Okay, we also have a question from the audience, which fits quite nicely into this line of thinking. It probably goes to Christian Kudela. Stefan Krenn has thrown in an interesting statistical argument. So he wrote in the Q&A session that within something like 2 weeks, more than 1,000 infections were reported in Austria. And only 10 confirmed infections were received through the Stop Corona app. Now, if we do the statistics and say about 10% of the population has installed and used this app, one would expect significantly more to be reported to the app. And I guess the question boils down to, where's the inconsistency? How can that be explained, that either it doesn't work or numbers are wrong? I mean, that's really inconsistent. And I wonder, Christian, if you can say anything to that.
Yeah, as I said in the conclusion of my talk, about 800,000 people downloaded the app, but I never said how many people use the app. And we cannot say how many people are using the app because there is no statistical functionality. I think it's the same problem as Matthias quoted out a couple of minutes ago. But I see he's shaking his head. So we do not know how many people are using the app at the moment. My opinion, not that much people, but this is my personal opinion. So I cannot really answer the question more in detail because there are no empirical data how many people are using the app in Austria.
Yeah, so we have 10 to 15% of people in Switzerland that are actively using the app, and we can count this both on downloads. Downloads are about 2 million, active users are 1.15 million. and we can count those by measuring when they pull the lists from the server. This is an anonymized number of daily users. So it's an approximation. It's not exactly correct, but it gives us an intuition on how many people there actually are. We do have about 10% of the cases, or more than 10% of the cases, that are actually uploading the keys. So we don't know how many of them how many we are missing. So this is an like for the COVID codes that are being given out, there's 10% of infected people are actually uploading data. So this is actually a good sign. We're hoping for a bit more. Another thing I wanted to mention is that several people in the talks mentioned that if only 10% of people have installed the app, you will get the 0.1 times 0.1 chance that you actually find a correct case. This assumes that all the users are uniformly distributed. So from a statistical perspective, I would like to make a note that there's likely clusters of people using the app. So even if you have a low saturation over the overall population, you may still get a good recall based on local clusters where people are actually using the app. Just as a side note that maybe falls into this as well.
Having also made this note of the distribution, I would like to ask, do we have an understanding what quality we need in order for this solution to be an acceptable solution?
Define acceptable. More is better.
Well,
right. So we know that people have been saved, right? We don't have exact numbers, but it's hard to quantify. How many lives saved makes it good? How many people need to be protected? And then there's the technical aspect from like, this is how many people have been warned. And then there's epidemiological concerns, how many people would have been infected. And this gets really, really fuzzy because it will be very hard to impossible to model on a case-by-case basis if this person would have been infected or not, if this person hadn't been warned.
Yeah. Well, background of my question is a bit like, we want to have the right social behavior, people following the right protocol of protection and having a certain understanding of what is different if the app is in use. And so I assume we as IT people are not the best ones to come up with well-engineered solutions for how to make people do the right thing, or how to observe and then impose additional policies in case observed behavior of people diverges from what we hope to have. But I assume the quality of the app links into what role it plays. And so in exchange with people that can fine-tune policies, we probably can find an answer about what is the needed quality.
Yep, I would actually agree on that. I think it's not our job as IT people to provide all these high-level policy decisions. So this plays into psychology, politics, and medicine, where experts from all these different domains will have to bring in their opinions and their expertise in addition to our expertise. We are providing a protocol that has been designed together with epidemiologists that gives epidemiologists all the required data and given the current technology, all the required amount of data without exposing, or with the minimum exposure of privacy risks to people. Now, how this app is being perceived by users, there's going to be a marketing campaign that needs to be done by the health authorities. There's political decisions where politicians will argue a long time about it along different ways and from different standpoints. And this is all outside our expertise. And I would refer to them to do these decisions. I don't feel qualified for that.
Okay, so I would like to move it to related but slightly different topic, and I would like to take this opportunity to bring in Dieter Gollmann, who joined us recently. And my question would be the following. We observe that the usage of these tracing apps is very different in the different countries. As an example, there's a country we didn't really talk a lot about so far, which is France. I have good friends in France, and they keep telling me, I mean, they have a centralized app, and they keep telling me virtually no one is using it. It's around, it's not being used, and I would like to challenge Dieter Gollmann a bit with the question of how is, this is an insider joke, sorry, so how does the trust in these apps come from? Is it a technological thing? Is it a cultural thing? Is the reason that the French people, for instance, do not use their tracing apps because they distrust in the centralized technology? Do they distrust in their government? Or do they distrust against anything in general? Is it a cultural question? So what do you think? What's the secret behind these very different ways of accepting this technology?
I think it's a culture. Do you hear me?
Yes, yes.
Yeah. So saying that it's a cultural thing, it's easy. Everything is cultural. It may have to do with what people are told about the purpose. In the previous discussion, the remark was made, the app provides every information to epidemiologists they need. I'm not sure that it does. What Kwok told about Singapore, one of the main objectives of the Singaporean Ministry of Health is to trace infection chains, to understand how infections happen. So then it's very important to know quite precisely who has met whom and when to make the links. When I was in Singapore in February, there were 2 initial clusters, 2 churches. And then at one stage, major breakthrough. We are very happy. We have found the 3 people who had been attending events of both churches. That allowed us to track infection chains. That one needs to model properly. The models I've seen are very imprecise about which part of the population is using the app, which part of the population is carrying the infection. The models ignore, as far as I can see, pretty much how infection event happens. We haven't discussed the role of media in forming opinion. I've been to one of the online conferences of Secure Business Austria. I don't know whether Christian was the guy who told us the story of one of his colleagues. The battle they had in convincing the media to tell the facts and not the opinions they had in advance. I think all of this influences attitude. Certainly expectations about your own government. I think in Singapore, the comment was people trust government and government trusts the people. In Europe, people trust government, but government does not trust their own people. And then you reach a stage where maybe people don't trust government, as in France. So I hope this were enough bones to pick for other panelists.
Yeah, well, anyone want to comment on that? Well, so there seems to be a general agreement with that. Okay. There is one question left from the audience I'd like to would have for Kwok Lam, and there's someone asking, you said that the Singapore app does not use the specification for Bluetooth low energy, but using something else. But according to, I'm not sure who actually asked that, that means that you drain the battery. So does Singapore have a different way of doing that, or do you just run that thing not on Apple, only on Google? So this is a very low-level technical question, but maybe you can say something on that. It was, I think it's in the Q&A section, if I remember correctly.
Okay, I honestly don't know what Bluetooth interface they use, but I have not come across anyone that complained that the battery drained very fast. But I think there's also another cultural difference here. Here we can have a charge point everywhere, and a lot of people carry a power bank with them. So that may not be as significant an issue compared to other places. So again, another situational difference.
So the energy carry around is higher than in Europe. That might be.
Yeah, but I want to make a separate comment. In fact, during this period of time, I see two different things that happen. Number one is a lot of countries, of course, including Singapore, it's now mandatory to wear mask when we go out. And at some point, there was this trend of using Face ID to unlock the phone instead of the passcode or the fingerprint. It becomes extremely inconvenient because whenever we use the phone, we have to remove the mask. I don't know whether this COVID-19 will change the trend of this device access control in future. Number two is because of this COVID-19, people are very concerned about physical touch or physical contact. And mobile payment using QR code becomes more compelling. In fact, in the past, I never used the mobile payment. Only until this COVID-19, I only use the mobile payment because I don't want to change banknote. I don't want to change coin. I don't want to pass a credit card to someone else. And then after they charge and they return to me. So, of course, it has nothing to do with the contact tracing, but I'm just making this observation because of the COVID-19, the scare about having physical contact. I don't know whether going forward there it will be a change in paradigms in terms of device access control as well as contactless payment or mobile payment.
Okay. I think that will happen everywhere. We see a huge push in digitization and contactless approaches. This is certainly a trend that we'll have observed and we will observe in the future. Okay, we have about 10 minutes more to go, and I would sort of like to start a bit of closing round. And of course, a big and very interesting question on all these developments here is what are actually the lessons learned in the past couple of months? I was personally actually quite surprised how fast things can happen, how quick development is possible. In particular, I saw this in Germany. We had SAP implement the app in a surprisingly short amount of time. I was working myself for 5 years in SAP. I know how big companies work and how that they are not the most agile constructs, but this was really a big surprise. So I would like to pose a general question. What are the lessons learned of the past 2 or 3 months in terms of technology, contact tracing, proximity tracing, and things like that? Is there anything we should have done better? Is there anything we should change in the future? Or what are the insights? If anyone wants to start with that. Yeah, please.
Sure. I'll continue the tradition of starting. I think the main lesson that I learned is that it's extremely hard to convince the general public, and that as soon as you roll out a service to a large amount of people, It's not just about technical solution and who has a better technical solution, but it comes in massively loaded with political arguments and other kind of trade-offs. And as soon as you're reaching out to the general public, you have to walk a very fine line on how you sell a solution and how you present different trade-offs, because everything will be evaluated in very precise details. So you have to be extremely careful on the messaging and on framing of your messaging. And you're not just talking to other researchers. We all know reviewer too, right? But you have to balance the way you present and frame your messages in a way that is palatable by the general public, which is very, very different from what I used to do before.
Thank you.
For me, it was very interesting to see that for the Austrian case, the app was kind of deaf before it really started because of the negative articles in the media. That was also Dieter already said. And also the ongoing political discussion. And another problem was that Accenture and the Red Cross decided to release an app which was, from a usability point of view, not working very well. Yeah, and if they have taken 2 or 3 weeks more to test it, to find the issues, I think the trust from the public would be much higher now. So this is one of my biggest learned lessons. Take your time when you need it. It does not really matter in the end, but the people will trust your app much more.
Yeah. Anyone else with lessons learned? Yes, please.
I think, I think from this this experience, and there is a strong case for those privacy preserving data sharing, or those privacy preserving search and record matching. There's a strong case for those research area. And in fact, for a different reason, we have a government-funded strategic research center to do that. But as I said, it's for a different reason. And the COVID-19 came too early before we have something that is completely implemented. But I don't know whether people will go back to the habit that when the COVID-19 is gone and they forgot about this issue and they reduce the priority of this research area. So I hope they won't.
Okay. Thank you. Johan Gescher wanted to say something on this?
Yeah, actually, this is not really something new, but I think going open source is quite important in all these developments, and this is so some lessons. So we have expected, but it was shown that this was really the best thing, and to start the discussion. And by going open source, we have, I think, gained a lot of trust also from an important community. And the second thing is also the treatment of the community, and the involvement should be taken carefully. So this somehow goes in line with what Matthias and Christian said, I think. You know, that you answer promptly on reviews, on questions, and that take a lot of effort. So that was the second thing.
Thank you. And I also think that, particularly in Germany, the reception from the community of these developers was, I tend to say, surprisingly friendly. So we are used to other things from government actors, and in this case, there was really a surprisingly friendly reception from the community and very constructive comments on the open source code and things like that. And this was actually a very positive surprise for me. So I'm really happy to have seen that. Yeah, anyone else with a comment on lessons learned in the end? Yeah, Dieter?
Question is there a plan in the public health sector where an app fits in and where it's then clear to evaluate afterwards whether the app met its purpose? Or is there a gut feeling that an app might be something good, let's get started with it and see later whether anything useful came out of it?
Okay, good question. So how do we measure the success of the investment? Can anyone say something educated on this? I'm not sure if we have the right people here to answer this one. No, I don't think so.
I mean, I can try to answer. I mean, of course, we have to evaluate it and compare it to the conventional system. I mean, an app which does not have a pendant with usual processes is hardly evaluatable. But here we have good chances to get data in the process to evaluate it.
And you plan to do this as well currently, or there is a concrete plan?
Yes, as I tried to sketch, I mean, we try to get data not via the app, but on parallel processes, especially from the health authorities, their usual processes.
But I think from a technical point of view, it's really hard to evaluate if the app if contact tracing makes sense, proximity tracing apps make sense, because in an optimal world we would not have false positives and false negatives, and we cannot really evaluate how many false positives and false negatives we had. Maybe Matthias can say more on that, because I think they collecting. They try to collect some TP3D data, but I think that's really hard to measure.
Yeah, but on the other hand, I mean, also in the conventional process, we have lots of false and positives, so to say.
But at least there you have the false positives, or am I right?
Yeah, correctly. So, but I mean, the app is not a replacement of the conventional process. It just adds information somehow, and then covers a portion which is not taken yet. And I think that is also, I mean, evaluating health authority processes is itself difficult. But they are established processes, and we should take them and adapt it and see what and also we needed to adjust some decisions on parameters. I mean, we need it quite urgent.
So the digital proximity tracing app augments classic contact tracing, classic manual contact tracing. So given that we have classic contact tracing as a baseline, we can measure some form of improvement based on, as soon as we have the statistics in place from the hotline and so on. Depending on there's been a couple of numbers published about classic contact tracing, but the efficacy numbers are really, really low of those, right? So even in the best case, for every person that you send to quarantine, like you will have to send many people to quarantine to have one person that is infected that is sent to quarantine, just due to the way the virus actually spreads. As soon as the statistics and so on are in place, we can actually compare the efficacy of the application compared to classic contact tracing, and then correlate the two numbers. And I'm sure there will be studies in half a year or a year that will come out that show all of these numbers. Right now, we were trying to build the app, deploy it, and are working with all the infrastructure challenges in addition to that to actually get it out and deployed.
Okay, this sounds like a very nice final word. And I would like to thank all of the contributors, the speakers, very much for joining this event. I personally enjoyed it a lot and I learned a lot. And we'll see, maybe we can repeat that sometime later and extend the lessons learned session or come with new insights, whatever. Again, thank you very much. I hope we have further opportunities to meet in these events, and we will keep you posted on how we deal with recordings and things like that. And have a nice evening.